Why is managing both OCD and eating disorder symptoms so complex? Imagine trying to untangle a knot that keeps tightening as you work on it. That's what managing both obsessive-compulsive disorder and eating disorders feels like for many people. These conditions often happen together and share some tricky features that make treatment more complicated. First, a lot of people with eating disorders like anorexia nervosa or bulimia nervosa also have obsessive-compulsive disorder symptoms. In fact, about 15 to 20% of those with an eating disorder experience obsessive thoughts and compulsive behaviors. Sometimes, this overlap is even higher, especially with anorexia. This means they might obsess over food, weight, or body image, but also have fears and rituals unrelated to food. Sorting out what's what can be tough for doctors and therapists. They need to carefully figure out which behaviors belong to which disorder to create the right treatment plan. Second, both disorders involve behaviors driven by anxiety and a need for control. Someone with anorexia might check their weight repeatedly or stick to strict eating rules to feel safe. At the same time, a person with obsessive-compulsive disorder might perform repetitive rituals to calm obsessive fears. These behaviors feed into each other and become hard to stop because they help reduce feelings of distress. Breaking these cycles requires patience and targeted strategies. Third, traits like perfectionism, high anxiety, and difficulty handling uncertainty are common in both conditions. These traits make obsessive thoughts and compulsive actions worse and harder to treat. When someone is very perfectionist, they might believe they need to be perfect in their eating or rituals, which keeps the disorder going. These shared traits make it harder to manage symptoms with standard treatments that focus on only one disorder. Fourth, when someone with an eating disorder becomes malnourished or starves themselves, it can make obsessive-compulsive symptoms worse. Starvation affects brain chemistry and can trigger new obsessions or compulsions. This creates a cycle where physical health issues and mental health symptoms feed off each other, delaying recovery. People might not realize how their physical state impacts their mental health, which can slow down getting help. Finally, treating both disorders at the same time is tricky because therapies for one might not work well if the other isn't addressed. For example, exposure and response prevention therapy for obsessive-compulsive disorder may need to be adjusted if the person is also engaging in restrictive eating or purging. Likewise, nutritional therapy for eating disorders must consider obsessive behaviors to prevent relapse. This means treatment teams need to work together and develop plans that target both issues at once. In the end, managing both obsessive-compulsive disorder and eating disorders requires careful assessment, understanding how they influence each other, and creating personalized treatment plans. It's a process that involves mental health experts, dietitians, and medical providers working together to help people recover physically and mentally.